You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, teratogen information specialist, and mother of four. Actually, my youngest just turned 1 year old. For those of you who are joining us for the first time, and even for those of you who aren't, a teratogen information specialist, which is what I do, is a person who gives information about exposures during pregnancy and breastfeeding, also before pregnancy happens, and in cases of adoption. And an exposure can be anything. So it could be a medication. It could be a question about, can I get my hair dyed? It could be a question about having a drink during pregnancy or breastfeeding. And it could also be things like supplements, things like treatments for certain conditions. There's a whole range of things that we counsel about. With us today, we have Dr. Sarah Običan, who is Medical Director of MotherToBaby Florida. She's a board-certified OB/GYN, and she specializes in maternal fetal medicine. She's an assistant professor at the University of South Florida. She is current president of MotherToBaby, and she is a member of the Society for Birth Defects Research and Prevention. Sarah, thank you so much for joining us today.
Thank you so much for having me. I'm so glad to be here.
We're really happy that you're here too. So we're going to talk about fertility treatments. We're going to talk about twin pregnancies. So I'm going to just jump right in with a question that I get commonly, which is, what types of fertility treatments are available these days?
Well, that's a really good question. There's so much available now to help patients get pregnant. A lot of it now first starts with just evaluation of ourselves as patients to make sure that we are healthy enough, that we have a reasonable, what we call egg quality, to make sure that our uterus looks appropriate by ultrasound and other ways to look at the uterus, that our blood work looks okay. And by having some of that baseline information, your doctor will help you guide you on some of the important things that you can do for yourself and your family. There are many things from just ovulation induction, meaning just to help you ovulate on a monthly basis. It can be from insemination, where you just need help to get the sperm to your reproductive organs and help you conceive that way. And then to the gamut of things like in vitro fertilization, where the actual eggs are removed from your body and the sperm from your partner. And then there's the fertilization that happens outside of the body to help some families conceive.
Really interesting. And like you said, there's so much available now. I'm actually going to take a step back, if you don't mind, and ask you, how did you become interested in this process, in the fertility process?
Well, it's very near and dear to my heart. I mean, my husband and I had infertility a long time ago and struggled with this in having our own families. And it's a process that's so hard and difficult for people. And I also have a lot of patients who go through this. So I feel I'm open to this and talking to patients about this. I've done this too. I've had to go through this process as well. And I love being open about it because it takes a little bit of that shame and difficulty around that situation for my patients.
I'm glad you mentioned that too, because, we do get some questions about, how best to prepare for fertility treatments. And there have been some people who said, I didn't want to look at this on my own. I didn't want to ask somebody, because they do feel that shame and they do feel that stigma around the fertility issue. And is that something that you see really commonly or something less so as time goes on?
It is really common. It is really unfortunate that we as women have to struggle with something like this, as if we already have this issue and trying to build a family, and then having the additional shame and in comfort with that, to live with that is really, really challenging. And I think the more we talk about it, the more we're open about it, the more we destigmatize this, just like we destigmatize miscarriage. I mean, those are really important aspects of just being a woman and just helping each other get through this process.
I think that's a really good point. There has been a shift, maybe not as much as we want it to be, but there has been a shift in thinking about, pregnancy loss and more people
Yes.
being open about that. And I do appreciate everyone who comes forward with any of these stories because it is really challenging, but putting it out there, you're doing a good thing, helping other people as well.
Yeah, thank you.
What do we know about fertility treatments? In that, some of the questions that we get, because of course, at MotherToBaby, we do answer a lot of questions about exposures, but what people ask us in terms of treatment is, are there any potential chances for an increased risk for birth defects once a person gets pregnant if they have a fertility treatment?
Oh yes, that's a great question, and so much has changed in the last decade. My first son, he's 8 years old, and I remember signing consents for those fertility treatments, and then later for now my 4-year-old son, and how things have changed, and how much more information we have now gathered in the scientific community. It's fascinating to also know and understand that even couples who have infertility, but then actually get pregnant on their own, still have an increased risk for birth defects. There's something about the fact that we have infertility that increases those chances. So it may be related just to that underlying disease state, if you will, and potentially also with some of the things we do to help us get pregnant. But you're right, with anything to do with in vitro fertilization, there is a slightly increased chance in terms of statistics in the literature that says, yes, we have a higher chance of birth defects, things like gastrointestinal, meaning like stomach problems or intestine digestive system problems, increased risk of some heart defects, and increased risks of other poor pregnancy outcomes. Now, the interesting thing too is that that risk is not incredibly high. In fact, the risk is about a 1% increase to the baseline risk. So it's not a tremendous risk, but it is higher than the baseline.
Gotcha there. Okay. So, and we use the word risk and chance, and it all sounds so scary. And it is,
Yeah.
it just anything, the unknown, I think for most people, especially me, feels a little uncomfortable, but it's good to know that, while there is this potential for the increased risk, it's not considered to be a high risk.
That's true, exactly. You do end up meeting some criteria that your doctor will pay attention to you more. And I don't think that's a bad thing, right? They have an additional ultrasound, and may mean that you may have what we call a fetal echocardiogram, which is a special evaluation of your baby's heart inside the uterus through an ultrasound to look at the anatomy of that baby. And it's really nice because we get to see so much of the function about the anatomy that we know this baby is going to do well after birth. And so it just helps us get ready for the delivery. So it maybe meets a little bit more criteria for better evaluations, better management during pregnancy, but it shouldn't increase our anxiety so much.
Excellent point. And hopefully, if you're having extra ultrasounds, it's another opportunity to at least briefly, take a look and see a cute little face or cute little baby in there. So I think too that it's helpful sometimes, when there's pictures, not only from a medical standpoint, but sometimes just the process can put people at ease.
Yeah, I absolutely agree.
That's awesome. I'd take more pictures of my fetus any day. But okay. Really, Sarah, and I'm sure you get this all the time, but the number one question that I get in relationship to fertility and fertility treatments is there anything that patients can do in general, of course, because everybody's different, but is there anything that patients can do to increase the chance of a healthy, successful pregnancy when they're considering fertility treatments?
Oh, absolutely. If this is like a great opportunity, essentially, you want to get pregnant. This is, by all intensive purposes, going to be a very planned pregnancy. And we should optimize on that by optimizing your health. And so every future mom should think of it in this way. Future parents should think of it that, this is my opportunity to, if I have any chronic diseases, to have some preconception counseling with my physician to optimize not only my health, but maybe treatment management, maybe discuss the medications that we're on, because we do get a lot of questions at MotherToBaby on medication exposures. And it would be nice to take care of all of that prior to even conception. We can maintain a healthy weight, increase our exercise and work on our nutrition. Optimizing our nutrition is, I think, one of a really big contributor to a healthy pregnancy. Also, what's really important is prior to pregnancy to make sure that we're on a prenatal vitamin and have increased doses of folic acid. That really helps in our organ developments for our babies. It helps to make sure that our hearts are nicely being developed, that our lips and our palate inside our mouth is being well developed. It is such an important aspect of a good nutrition. And I think just appropriate nutrition is so important for a healthy pregnancy outcomes. It's the one thing we can do as parents that how we can have an effect on, right? We can't change our genetics. We can't change our age, no matter how much we would like to, but we can change our diet and making sure that we're giving the best environment for our future babies.
Well, thanks for that, Sarah. Because again, that's something that we just get so often. And you're right. When it's something this planned, there are some steps that we can take. And so, while everyone's going to be a little bit different, just make sure you check in with your healthcare providers. That way, if there's anything special that they want to offer to you or anything they want to talk to you about. So how much folic acid, or if there's, certain other vitamins that you may need or tests that they want to run, then they can go over that with you so you have plenty of time to plan. Okay, so I'm going to switch gears a little bit and sort of go in a slightly different direction. So fertility treatments can result in multiple pregnancies. Is that correct?
Yes, the idea is to obviously have a pregnancy through any kind of treatments such as in vitro fertilization, but there is a risk that we would have what we call multi-order pregnancies or twins or triplets from having procedures like this. Now, physicians who do in vitro fertilization for patients have become really cognizant of that, and they are attempting to, in their practice, make sure that they place one embryo or at most two embryos to decrease the risk of having twins and triplets. And that's because even though we think maybe they're cute and they're fun to have in the family, the truth is they come with a tremendous amount of more risk to the pregnancy. In fact, twins, just in and of itself, they carry the greatest risk after an in vitro fertilization. The twins could have an increased risk for mom. Twin pregnancies, they have higher risk of high blood pressure in a pregnancy, higher risk of nausea and vomiting and development of diabetes. They can have a higher risk of preterm birth. The average gestational age when twins are born are more like 35 weeks, 37 weeks, rather than the 40 weeks of a singleton. And obviously a more increased risk of having a cesarean delivery, which has some of its own innate risks of being a surgical procedure. And for babies, being born preterm can be quite a bit of a problem. They can have feeding difficulties and neurological difficulties and have immature lungs, which would be difficult for them to breathe when they come into the world. So we are really trying to be cognizant of this and making sure we decrease the risk after IVF pregnancies by decreasing the chances of having twins, for example.
Gotcha. Okay. And I know that, there's the two types of twins. Can you tell us a little bit about that?
Yes, of course. So there are really, you're right, two types. One we call monozygotic and the other is dizygotic. So the dizygotic are what we say fraternal twins. So you can have the brother and the sister. It can be male and female. They're not quote unquote the same. And monozygotic is when you have one sperm and one egg that have joined and then split into two to make twins. And these twins tend to look a lot more alike than the dizygotic twins. Now, in that, there's also a little bit of variation as well, where you can have a monozygotic twin pregnancy, meaning from one egg and one sperm, and they can have one placenta but two separate sacs, or one placenta and one sac. And of course, that last one would be the most dangerous because they would be essentially in their same space with each other.
And that happens when the twins are what I think of as identical. Is that right? When it comes from one embryo, okay, versus two. When it's an identical twin set, is that more risky than when they're not identical?
Yes, that's a great question. It is that concept of one egg and one sperm splitting into two is actually what increases the risk of birth defects. So our twins that are we call monochorionic, one placenta, and that have two separate sacs, those twins have a higher risk of things like heart defect and really all kinds of birth defects, more so than the two separate twins that are from two separate eggs and two separate sperm.
Okay, well, Sarah, thank you for this information. There's a whole lot that we talked about today, but what I would like to end with is if someone is considering fertility treatments, what are some frequently asked questions that you get, or what should people be thinking about and asking when they're making these decisions?
Yes, that's a great question. Families should really be talking with each other. I think first to make some questions and decisions about what they really are interested in doing. What are some of the possibilities for that particular family? And then as a unit or whoever's making those decisions goes together to visit physicians and get things like information about what are some of the tests that are going to be happening to me. What are some of the blood works? Why is that done? What is my egg quality? What are my chances of doing which different fertility treatments, and which one is the right for me? I think finding the right fit with the physician that's going to be taking care of you is one of the biggest things I would say to families, because that makes all the difference, right? Somebody that can explain things to you and give resources to you is really important. And then making sure that you see your obstetrician, so the person who's actually going to take care of you during the course of your pregnancy, and get information prior to conceiving on all those ways you can optimize your health before getting pregnant. That will make all the difference.
Especially like you said before, things like medications and, any vitamins, deficiencies, anything you need more of, anything you need less of, maintaining that healthy weight. It's all good information. And hopefully, it'll be helpful to people when they're on this journey to grow their families.
Yes, absolutely. It's a long process, but well worth it.
I'm very glad to hear you say that. And I'm glad to know that there are options for people who want to grow their families and aren't able to do it in the way that we usually think about. So, and again, Sarah, thank you so much, not only for being here, but for sharing your expertise and, your personal journey, because it is something that's helpful. The more and more we talk about it, the more people feel okay about being open about these types of challenges.
Oh, it's such a pleasure. I completely agree with you. This is what we should be doing, is completely being open with each other and supporting each other.
I agree. Thank you. And thank you to everyone out there who was listening today. We're so glad that you were here for this episode, but don't forget, we're going to be back in the future. We're going to have other experts, other topics, lots of other things to talk about. And we're here, in between podcast episodes. MotherToBaby is here to answer your questions. So as always, you can call us toll free at 866-626-6847. You can text us at 855-999-3525. You can visit our website at MotherToBaby.org. And from there, you can chat. You can look at our fact sheets. You can go to our web pages. We have lots of information, including information on things like the COVID-19 vaccine and pregnancy and breastfeeding, along with a lot of other resources for you to look at. So feel free to contact us at any time if we can help you. And we hope that you'll be back for another episode of the podcast. So make sure to follow us so you never miss a new episode. And perhaps you know somebody who is thinking about it, growing their family, or someone who's newly pregnant or has questions about breastfeeding or adoption. So feel free to not only share our information, but share the episodes of the podcast. If you have a question for the podcast, we would love to hear from you. If you want to be on the podcast, we would love to have you on. So you can email us at contactus@mothertobaby.org. I look forward to being with you again in the future. My name is Chris Stallman. So glad that we can still keep this going in these challenging times. And so please remember, MotherToBaby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.